everyone, and thanks so much for joining us here today for this news conference. We clearly have a lot to share and a lot of really exciting things to share. So joining me as speakers today are Lincoln City Councilmember Brody Weber, City of Lincoln Urban Development Department Director Peter Hein, Sinclair Hilly Design Architect and Principal Dan Grasso, President and CEO of Centerpoint Topher Hansen, and Senior Project Director with the UNL Center on Children, Families, and the Law, Jeff Chambers, who is also representing Lincoln's Homeless Coalition. We're also joined in the room by a lot of committed community leaders who I'm just so proud to work with and to call friends. We're here joined today by Lincoln Housing Authority Executive Director Chris Lamberty. We have Project Control Vice President Caleb Swanson and our former Urban Development Director Dan Marvin, whose support of this project and presence here today we greatly appreciate. We also have our colleague from the council, Councilman Benny Shobe, here today, who cares very deeply about the issues we'll be discussing. As a city, we have set an ambitious goal to be the safest and healthiest capital city in America. And to achieve this goal, we are pursuing a number of high priority pillars together with our community partners. This morning, we're here to provide an update on one of these priority pillars, the first city-owned permanent supportive housing project. And through this project, to be located across from the county city building at the corner of 8th and J Streets, we will construct 24 individual apartments and offer supportive wraparound services to help individuals experiencing chronic homelessness get off the streets and back on their feet. And today I am pleased to announce that the City of Lincoln has hired Sinclair Hilly as the architect for our permanent supportive housing. I'm thrilled to unveil the initial renderings of the project for you today. So we're going to show a few slides. And here's a view of the project from J Street. We have another view from the corner of 8th and J Streets. And then a view from the sidewalk along J Street. I'm also really pleased to announce that Centerpoint will be responsible for operating our new housing. The City of Lincoln and Centerpoint already partner on multiple efforts that support the health and safety of our residents, and we look forward to enhancing our longstanding collaboration by delivering even more value to our community through this permanent supportive housing. So with these trusted and established local organizations and partners on board, we are on schedule to build this first city-owned permanent supportive housing and on track to achieve our goal of functionally ending chronic homelessness in Lincoln. We're working to ensure that everyone in Lincoln has a safe and supportive place to call home. Our state and federal partners have provided vital support for both the construction and the operation of this project. We are especially grateful to the Biden-Harris administration, whose American Rescue Plan Act funding has come to the City of Lincoln to the total of $5.2 million for this particular project. And that's been allocated through our Home ARP program funds and the State of Nebraska Department of Economic Development ARPA funds. We're also thankful to our partners at the U.S. Housing and Urban Development Department for their grant to support the project's operations and maintenance costs. And with that, I'd now like to invite up our Director of Urban Development, Peter Hein, to share more details about this important work that he is helping to lead. Director Hein.
Thank you, Mayor. I want to begin by recognizing that we stand on the shoulders of former Urban Development Director Dan Marvin, current Community Development Manager Wynn Urmstad, Urban Development Program Specialist Brad Schmeichel, our team at Urban Development, and Lincoln Homeless Coalition, and a continuum of care whose tireless work on this project has led us to this day, a truly exciting day for the City of Lincoln and Urban Development. The data show we have a need, and we are responding to that need in a big way. With today's announcement, the City of Lincoln will have its first city-owned permanent supportive housing solution for some of the most vulnerable residents of our city. While this housing-first approach to homelessness is based on proven models in other cities, our selected design and operations team have completed a thorough verification process. Our process will ensure Lincoln's housing solution is reflective of our needs, is based on dignity, is durable, and responsive to our environment and context. Project management will be completed by Project Control, an important partner with the City of Lincoln for cost management and assuring construction quality for the duration of design and construction. As of today, we have completed soils analysis on the site, and we have a green light from the geotechnical engineers to move forward. We have assembled an award-winning design team led by Sinclair Hilly Architects in collaboration with R.O. Euchre for structural engineering, ETI for mechanical and electrical design, and Olson for civil engineering. Design development is underway, and we plan to submit the building permit later this summer. We'd also like to recognize and thank our Lancaster County and Public Building Commission partners for their willingness to work with us on assembling the land, while also improving parking access and security along 9th Street. Housing is a complex issue and a basic human right. Through the priority placed on this issue by the mayor, our City of Lincoln team and the Urban Development Department in particular works to support new and rehabilitated affordable housing through federal and local grants, provides zero-interest home improvement and emergency repair loans, grant funding to improve the quality of rental units, as seen in our South of Downtown rental rehabilitation project, contributes to Lead Safe Lincoln through our grants to remediate housing with lead-based paint, and we require a percentage of our new residential projects utilizing tax increment financing to have affordable units within their core design strategy. This permanent solution to chronic homelessness is evidence of our unwavering commitment to creating solutions that ensure everyone in Lincoln has a place to call home. Everyone. Thank you.
Thank you, Director Hind. I'm here to share more about the design features and walk through the project renderings is Sinclair Hilly Design Architect and Principal, Dan Grosso. We're so pleased to have you on board.
Thank you, Mayor.
Thank you.
Thank you, Mayor. The permanent supported housing project building would be located on the corner of 8th and J Streets in Lincoln, Nebraska, across the street from the Justice and Law Enforcement Center and Mental Health Crisis Center. The project is 2 stories, approximately 15,000 gross square feet, consisting primarily of 24 single bed dwelling units, a secure entry lobby and reception, a secured covered front porch, shared multi-purpose kitchen and gathering space, common space for individuals, residents to gather. Also a shared laundry room. Secure offices, meeting space for the CenterPoint staff, and 11 off-street parking stalls for the Center Street staff and visitors. There's also a fenced backyard north of the building to provide additional private green space for the residents. Residents will be able to lock up their bikes as well as work in the garden that will be provided in the back of the project. Trauma-informed design has played a significant role in the development of a plan, color choices, and layout of the physical environment. The physical environment can impact one's attitude, mood, health, and well-being. Individuals experiencing chronic homelessness have been shown to thrive in spaces that follow basic design principles of trauma-informed design: safety and trust, community and collaboration, choice and empowerment. The new building will be located in the Capital Environs District. Therefore, the building facade will consist primarily of masonry, cast stone details, some accent panels at the dwelling units. Thank you.
Thank you so much, Dan, and thank you to your team at Sinclair Hilly for the incredible work on this project. These designs are absolutely gorgeous, and I think convey that commitment to dignity and respect that's going to be so important to the success of the project. I'm here to share more about CenterPoint's role in our permanent supportive housing is CenterPoint President and CEO Topher Hansen. Topher?
Right here. Thank you, Mayor. So these are complex issues, and I want to thank you, Mayor, for all the work you have done to assemble this, because the financing and the organization just to put up a building like this is a monumental project and is a huge step forward in helping the city address some of the issues we face. So thank you for all the work that you have done to assemble that. In addition to the financing and organization of it, it also is a team like this that brings forward the best quality in putting together this project for the success of the project, and most importantly, the success of the people who will be served by the project. So Maslow taught us this a long time ago, that the basic needs is where it all starts. And at first we got to get the housing and the clothes and the food to get somebody stabilized, and then you begin to go. Living without stable housing can drastically worsen health. Homelessness can exacerbate mental illness and make ending problematic substance use very difficult, and prevent chronic physical health conditions from being addressed. People with these and other health issues often end up in crisis situations while living on the streets, and emergency rooms may be the only care they are able to access. Although affordable housing is part of the solution, some people may need their housing coupled with supportive services to maintain it. Research shows that supportive housing effectively helps people with disabilities maintain stable housing. People in supportive housing use costly systems like emergency health services less frequently and are less likely to be incarcerated. Supportive housing also can aid people with disabilities in getting better health care. CenterPoint employs a fully integrated, whole health, person-centered philosophy whereby all facets of the organization work together to help the individual in service get better, sooner, for longer. Case managers, maintenance staff, and security personnel in this particular program will be available to provide 24-hour staffing 7 days a week. Referrals for admissions to the project will be exclusively from Lincoln's Continuum of Care and the All Doors Lead Home Coordinated Entry. The administrative management of the project will be the responsibility of Maggie Peavy, Director of Housing Operations, and Jacob Grell, Housing Coordinator. Amber Dirks, our Senior Director of Community Response, will be responsible for direct supervision of case management staff. Those people are here with me today and are an integral part of why this will be a success: housing, supportive services, and effective management. The management of the housing will be the responsibility of Jane Keene, the Senior Director of Facility Operations, who will oversee all facets of the management of the physical project itself. CenterPoint's case managers understand the intersectionality between mental health and substance use disorders and homelessness, and they work tirelessly to meet the complex need of the program participants. CenterPoint staff will work with individuals in service to obtain the services and benefits they are eligible for. The proposed location of the project at 8th and J Street is conveniently located near CenterPoint's new Campus for Health and Wellbeing. We call it CHW, at 2202 South 11th Street. In addition to receiving supportive services in the proposed residential location, residents will also be able to access a wide variety of services, including primary care, pharmacy, counseling, and crisis support at our CHW location at 12th and South. Because CenterPoint's street outreach team is integral in working with the unhoused population and identifying those eligible for housing programs, outreach staff will continue to work with an individual for a time after they have been housed to assist in a smooth transition and help to address any issues that may arise. I should add that CenterPoint currently operates about 215 units of supportive housing through grants from Housing and Urban Development and the Veterans Administration, and served over 5,000 people last year in its total package of services. CenterPoint's integrated team approach brings all facets of supportive services together to help reduce lease violations, which result in fewer lease terminations, and which ultimately results in a resident remaining stably housed. Thank you again, Mayor. Thanks to this team. It's been a great effort thus far.
Thank you so much, Topher, and to everyone on your CenterPoint team, because we couldn't do this without you, and we're so pleased and proud to be able to partner with you. We're really, in addition to being committed to providing housing, stability, and dignity for our homeless population, our city's permanent supportive housing also provides a financial benefit to our community. And here to talk more about what exactly that looks like is Jeff Chambers, who, as I mentioned earlier, is our Senior Project Director with the University of Nebraska-Lincoln's Center on Children, Families, and the Law, and also a leader in the Homelessness Coalition. Jeff?
Thank you, Mayor. The City of Lincoln and the Lincoln Continuum of Care are continuing the important work to make homelessness rare, brief, and non-recurring. Successes towards this goal include achieving functional zero for veterans homelessness, reducing the number of people experiencing homelessness by 17% since 2017, reducing the number of youth 18 to 24 experiencing homelessness by 8% since 2017, and providing over $55 million in rent and utility assistance since the pandemic. In addition, we've increased the number of housing units available for families experiencing homelessness. One of the reasons we are proud to support this new permanent supportive housing project is the potential for it to help us move the needle on addressing one of the most complex housing challenges, as Topher has mentioned, chronic homelessness. Over the last 7 years, while overall homelessness has decreased, the percentage of homelessness that are chronic has increased from 12% to 24%. Chronic homelessness are persons or families with a person that has a long-term disability and has been homeless for 12 months continuously or 4 times in the past 3 years. Persons and families experiencing chronic homelessness are the most challenging group to obtain housing for initially and to retain housing long-term. The factors that have contributed to their chronic status also work against long-term housing stability. Persons who are chronically homeless are high utilizers of our emergency and acute care systems in Lincoln, such as hospitals, fire and rescue, community corrections, and mental and behavioral health. For people experiencing homelessness in unsheltered locations in Lincoln, over 50% are chronically homeless. A recent study by the UNL Center on Children, Families, and the Law examined 24 individuals that were experiencing chronic homelessness. A very conservative estimate of the acute care system cost used by these 24 individuals over a 3-year period was $2.5 million. The most effective means of ending chronic homelessness is permanent supportive housing, and CenterPoint is a premier provider of that in Lincoln. Housing persons experiencing chronic homelessness in a permanent supportive housing program reduces the acute care system cost borne by the community from 40 to 60%. That is, when a person is housed, they are less likely to use the acute care systems. For the 24 chronically homeless individuals in our study, this would result in a saved cost over 3 years from $1 million to $1.5 million, and an annual acute system cost reduction of up to over $500,000 per year. The City of Lincoln's permanent supportive housing project will provide housing for persons experiencing chronic homelessness and currently living in unsheltered locations, decrease the burden on many acute care systems in the community, including hospitals, law enforcement, fire and rescue, and corrections, and avert acute care system cost up to $1.5 million over 3 years. This project works on multiple levels, improving individual and community quality of life for all Lincoln residents, reducing homelessness, and decreasing costs to the Lincoln community. It's the Lincoln way. Thank you.
Thank you, Jeff. We are so grateful to you and to everyone at the UNL Center on Children, Families, and the Law, and all of the work on continuum of care. Your numbers help tell this full story, and we're so grateful to be able to use the data and evidence that you gather to act. And as we act and pursue our goal to become the safest and healthiest capital city, we work in partnership with the members of our Lincoln City Council. And next, I'd like to invite up Lincoln City Council member Brody Weber. Councilmember Weber.
Thank you, Mayor. I am so grateful for your leadership on this critical issue. As we move forward on the first ever city-owned permanent supportive housing for the chronically homeless, this has really been a team effort with the administration and our city leaders and our community stakeholders. Those who have worked hard to get this project off the ground and to keep it on schedule, which is pretty important. I'm beyond proud of the fact that this facility, being located across from the City County building at 8th and J Streets, will be in Northwest Lincoln's District 4. It cannot be underscored enough that this facility will provide a tangible solution for those experiencing chronic homelessness across our city with the dignity that all residents deserve. And with CenterPoint's operational expertise and excellence, I can say with absolute certainty that we have the right provider in place to ensure that these individuals receive the wraparound services that they need to get back up on their feet. The beauty of this project is that it understands that a home is a foundation, but that support services are absolutely critical for success. This project is another step in ensuring the safety and health of everyone in our community, as well as providing an approach that will decrease the cost for hospital visits, the cost for law enforcement, fire and rescue, and corrections. I want to sincerely thank everyone again who has worked so hard to get us to this point, and I look forward to seeing the continued success in establishing the first ever city-owned permanent housing for the chronically homeless. Thank you so much.
Thank you so much for your leadership and your collaboration, Councilman Weber. Today's announcement underscores how the City of Lincoln and our community are committed to growing an equitable and inclusive city where all residents are safe, healthy, housed, and have the opportunity to thrive. And with that, we would be very happy to take any questions you may have.
The 24 beds, it's permanent supportive housing. So is there a turnover? Is the goal to house people there for a certain amount of time and then move them into other housing? I mean, are you helping just 24 people, or will you help, does it ultimately help more than that?
When people move into this particular housing, they have the opportunity to stay as long as they like. But we certainly do expect that eventually there will be turnover and that we'll be able to help more people. But Peter, do you want to address that? Do you have any other?
I actually think Topher would
Or
be the best
Topher?
to
You wanna
address
Sure.
that question.
Yeah, so just like the rest of us, people move. And by its name, permanent supportive housing, this is a place that they can move into and live the rest of their lives. On the other hand, they can also decide that they want to move and go elsewhere. If there are violations of the rules of the housing project that really contravene the lease that everyone will have, then it's possible that we would ask somebody to leave. We try our hardest not to do that. We know that people come in and have issues in having lived on the streets for a number of years, and that they need to acclimate to a new environment and to a new way of living. And so our team works really well with helping people to make that adjustment and to be there for as long as they want to be. Does that get the answer?
Yeah, it does.
Okay.
And the other question I had about that is how are people referred to the program? How do people get into this housing?
Yes, they'll be referred by the all doors lead home.
All doors.
Our continuum of care. Under HUD, the people who provide housing services all sit in a meeting, and we work together to then find who's in need of housing and rank those needs by an objective study of their situation. And then we know who is a top priority and who, on the other hand, maybe was identified, but on their own they will be able to find housing, right? So people off that list will be those that come into this program.
So this is like a HUD committee, just with providers throughout the community?
Yes. And all communities that have HUD money as or programs like this have continuums of care, and we have one in Lincoln and have for a long, long time. In fact, Centerpoint was one of the first on that. We're one of the first two. Jeff, did you have more?
Yeah, I just wanted to.
You can get the names right if
Yeah.
nothing else.
So it is All Doors Lead Home, and it is so the continuum of care, as Topher mentioned, implements this system which every individual that experiences homelessness is identified in Lincoln. They are assessed in a common manner. Everyone receives the same assessment no matter where they present. So if they present at the shelter, if they're presenting to street outreach, they're all assessed in the exact same way. They're prioritized based on those objective factors that Topher mentioned. And then when housing opportunities present in the community, so say one of these 24 units comes open, Centerpoint staff will go to that list in priority order and identify who is at the top of the priority list, and that unit is offered to them at that point. They can choose to not take that opportunity, and then they go to the next person. So every individual that is experiencing homelessness is identified in Lincoln, prioritized for the available housing resources we have, because they are very limited. And that's, as Topher mentioned, those that are less highly prioritized, their homelessness is no less real to them, but we have to make decisions about our limited resources.
And they're ID'd by police and and any other services they access?
Yes, in any part of the homeless service system in Lincoln, from outreach to the new alternative response with LPD is part of that. They're referring individuals to the All Doors Lead Home system, the shelters. So anyone can do that. Our domestic violence shelters are doing. And if you go to the UNL Center on Children, Families, and the Law website, more information about the All Doors Lead Home system is available there.
Only other question I had was the 300, or was there another one? I'm sorry. No. I'll be quick. The 300,000, I think it's 300,000. Is that the supportive, is that the HUD grant to help operate? Maybe
It's about 249,000 annually. Yes, we received a grant, and our team at Urban Development applied for that. Wynn Yermstead was the lead on that, and we're really pleased to have that stable operational funding to help make this project go.
And will that cover all the operational expenses, or?
No. We are still working through finding the additional funds for the remaining operational expenses, but we're in a really solid place with the funding to construct and the baseline operations, and we're determined to make this go.
Do you know what the annual operating expenses will be, or what you're estimating them to be?
You have the additional.
I don't have the exact number right now, Margaret, but we are working on finalizing the construction budget and the operation budget. I think I would also add that we will be working with Lincoln Housing Authority on their voucher program and working with them on covering some of the costs as well.
Any other questions from the media? Okay. Well, thank you so much for being here with us today to learn more about the City of Lincoln and our community members' efforts to address and end chronic homelessness and support the safety and health of everyone who calls Lincoln home. Thank you.